I want to share with you one of my favorite books in the world. To be honest, it's not a page-turner. In fact, the plot is fairly predictable, the descriptions are dull, and to let you in on a secret, I haven't even finished the book yet. But I highly recommend it to everyone. The Red Book. I don't know how many of you may be familiar with this. I certainly am. The NHS, that's the National Health Service, gave it to us when my 2 boys were born in this country. Every child born in the UK gets one of these. The reason why it's great is because it's a big red reminder of all the medical appointments coming up for every child born in this country. At a time in my life when I was exhausted, distracted, overwhelmed, this Red Book helped me keep track of every upcoming immunization out there. Immunization, one of the most cost-effective, evidence-based, life-saving intervention out there. The WHO estimates that vaccines save 2 to 3 million lives every year. Yet, 1 child under the age of 5 dies every minute because of vaccine-preventable diseases. That's 1 child every minute. We at Suvita want to change that. The WHO estimates that globally 19 million children have not received their basic vaccinations by the time of their first birthdays. Half of these children are in India. That is 10 million children in one country that have not received their basic vaccinations.
The Red Book is a great example of one of the many nudges that we benefit from in the UK to aid us in making healthcare decisions. But you might be wondering why we're talking about the benefits of a small nudge like this on the one hand, when the problem still exists at such a large scale on the other. Maybe the issue doesn't lie in nudges like this and in key supply-side interventions. What if the reason that children aren't getting their vaccinations is because there aren't enough clinics near them, or the distribution system is too unreliable? Maybe their parents are resistant to vaccinations, or they're worried about the side effects. The evidence from India suggests that none of these is the key issue. In a survey of nearly 40,000 parents living in some of the most challenging districts in terms of achieving good immunization coverage, the reason most commonly given that a child hadn't been brought for a basic vaccination appointment was simply a lack of awareness that they needed to go. Over the last few years, the Indian government has made major investments in strengthening the supply of vaccinations across the country. And this evidence from parents suggests that the solution now lies in the demand side, and specifically in better communication with parents about the timings of immunization appointments and the importance of bringing their children. At Suvita, we're proposing a simple community-led nudge to help address this immunization gap. It might not look exactly like the Red Book, but it shares many of the same principles in providing a simple reminder to parents about key medical appointments. A number of senior economists from MIT's Poverty Action Lab recently conducted a large-scale randomized controlled trial in Haryana in India. They identified a nudge which significantly increased vaccination rates in this area by a fantastic 22%. So you might be wondering, what is this innovative new communication intervention? Well, actually, it's probably as old as communication itself. Gossip. The researchers identified the gossips in town by asking a random selection of households, if there was an event going on in the village, who would you hear about it from? Who would be spreading that information? The most frequently nominated gossips were then invited to become volunteer immunization ambassadors within their community. They were kept up to date with their agreement about the key details of local immunization camps, and they were then free to share this information with whoever they wanted within their village.
It turns out these gossiping ambassadors spreading information on immunization camps are highly effective. In fact, as Fiona mentioned earlier, as a result of this intervention, there was a 22% increase in the number of parents taking their kids to get them immunized. That is high impact. In addition to these substantial benefits, we think the costs are fairly low. In fact, the two broad cost areas we have identified are, one, a relatively straightforward process of visiting a random set of households to identify the gossip ambassadors, and two, to regularly update these ambassadors on the upcoming immunization. So thanks to these low costs and high benefits, we think this intervention can be highly cost effective. In fact, we believe there's a good chance that this intervention can be one of the top global health interventions in terms of cost effectiveness. The state of Haryana is currently working with the MIT researchers we mentioned earlier in exploring ways to embed this gossip intervention within the state government health system. But at the same time, despite these promising results, we are not aware of any other state government or any other charity, nonprofit agency looking to either replicate this intervention or scale it up anywhere outside of Haryana. That's where we come in. Suvita will harness the power of nudges to ensure that children do not miss out on these amazing benefits of immunization.
We're particularly excited about this opportunity because we now have the chance to build upon a high-quality, large-scale randomized controlled trial, which was conducted in the country in which we're planning to work. And it also builds upon a broader evidence base. So, what's our plan? At the moment, we're focusing on building a really solid foundation for scaling this program up in a new state. We recently visited India to meet with a number of relevant stakeholders to investigate their work in this space in order to make sure that we complement rather than duplicate existing actors. This has made us more confident that there is indeed a relevant gap that we could fill. Our next steps are threefold, and they all tie into our belief that it's vital to take a thoughtful and well-considered approach to make sure that we avoid leaving any potential impact on the table. Firstly, we're in discussion with the researchers about results which are soon to be published from a second phase of the Haryana study. These explore the possibility of potentially increasing the impact even further by complementing the ambassador system with other community nudges, such as cash transfers or text message reminders. Secondly, we need to decide which state to work in. For this decision, we're including a large number of relevant factors, ranging from current immunization rates in different states and key supply-side indicators, all the way through to other actors working locally, and government levels of interest in programs such as this. Thirdly, we plan to conduct a systematic literature review to get a clearer understanding of the global evidence base into which this study fits. This evidence-driven approach is vital to our work at Suvita. We believe that it's not good enough to simply assume that we're having a positive impact, and we intend to rely on rigorous monitoring and evaluation procedures to ensure that that is the case. We believe that by applying these principles to this rigorously tested approach of empowering community ambassadors, Suvita will help to address the persistent injustice of vaccine-preventable disease. Through using an evidence-based, cost-effective, and impact-focused approach, our mission is to ensure that in future, the 10 needless child deaths that happened while we've been speaking will be a thing of the past. Thank you.